killing it.
So, we had 6 symptoms that didn't add up to anything. Now we got 7. Who's excited?
I don't think it complicates things. The kidney failure was caused by the antibiotics.
Maybe.
Typically, low blood pressure and abdominal pain means an infection. An abdominal infection causes sepsis, low blood pressure.
Except we checked for abdominal infections.
I know, but what if it's the other way around? What if the low blood pressure is causing the abdominal pain?
Viral heart infection. The intestines aren't getting enough blood, and the result is belly pain.
I know it's not the standard presentation.
It's a 10 million to 1 shot.
Thought that's what we dealt with here. It explains the cardiomyopathy, pain, the low BP, the fever.
You read the book. Impressive. It's a ludicrously long shot that explains every one of those symptoms, except for the cough and the rash. Should we just erase those?
Well, anything can cause a rash.
Okay. Cardiac infection. Cameron, you thought allergy? Chase, what was it? You thought carcinoid? And then there's hypothyroidism. Could be parasites. Finally, sinus infection.
If you're gonna list all the things it can't be, you're gonna need more colors.
Cameron was right. No condition explains all these symptoms. But orange and green covers everything.
Orange and green, 2 conditions contracted simultaneously.
Occam's razor. The simplest explanation is always the best.
And you think 1 is simpler than 2.
Pretty sure it is, yeah.
Baby shows up. Chase tells you that 2 people exchanged fluids to create this being. I tell you that 1 stork dropped the little tyke off in a diaper. You're gonna go with the 2 or the 1?
I think your argument is specious.
I think your tie is ugly. Why is 1 simpler than 2? It's lower, lonelier. Is it simpler? Each one of these conditions is about 1,000 to 1 shot. That means that any 2 of them happening at the same time is 1,000,000 to 1 shot. Chase says the cardiac infection is a 10 million to 1 shot, which makes my idea 10 times better than yours. Get a calculator, run the numbers.
We'll run the tests.
Tests take time, treatment's quicker. Start the kid on Unison for the sinus infection and... what was orange?
Hypothyroidism.
Men are lucky they can only have 1 orgasm. You know that women can have an hour-long orgasm?
Hey, Foreman, what's up?
Hey, Foreman.
White cell count isn't up, is it?
No. We were both wrong. White cell count is down, way down and dropping. His immune system is shot. We need to get him into a clean room.
Can you walk, Brandon?
Yeah, a little.
Okay. Because we'll need to leave the chair outside. Thank you. There's April. April! Can you take the chair, please? Thank you. I'll need to take your mask and your robe, too. You might want to block your ears for this. It's quite loud.
Something's made him immunocompromised.
His white blood cell count is down, which means his body can't fight off infections.
If he gets sick, he'll die.
Sick? How sick?
If he gets a cold, he'll die. Okay. I'm gonna push the needle into your hip bone and take some of them out.
That's not so bad.
Uh-huh. That was just the anesthetic. The core biopsy needle, it's a bit bigger. Hey, man, take a deep breath. This is gonna hurt a lot. Marrow makes the blood cells. Take a peek at it under a microscope. Maybe we find a viral infection. Maybe we find some fibrosis. Something to explain why your blood count is so low. There we go. One step closer to an answer.
If you don't find one, I can't stay here forever.
The patient could have died.
The one with the pulled muscle.
Those symptoms are consistent with a dozen other conditions. I mean, I'm entitled to a consult.
You are not getting out of clinic duty.
Come on, you got 100 other idiot doctors in this building and go all warm and fuzzy every time they pull a toy car out of a nose. You don't need me here.
No, I don't, but working with people actually makes you a better doctor.
When did I sign up for that course?
When did I give you the impression that I care?
Working in this clinic obviously instills a deep sense of compassion. I got your home number, right? In case anything comes up at 3 o'clock in the morning.
It's not gonna work. You know why? Because this is fun. You think it's something to make me miserable. I think it's something to make you miserable. It's a game, and I'm gonna win because I got a head start. You are already miserable. Is this important?
No.
Good.
What's with you and her?
Don't.
You have a thing for her. The only people who can get to you.
There is not a thin line between love and hate. There is, in fact, a great wall of China with armed sentries posted every 20 feet between love and hate. 36 Vicodin.
Who's the patient?
I am.
You can't.
Dr. Wilson is the prescribing physician.
Yeah. You will lie, cheat, and steal to get what you want, but you're incapable of kissing a little ass.
Well, we all have our limitations.
House. Wrong bottle. Do me a favor. Take one of these, wait 5 minutes for it to kick in, then find Cuddy and kiss her ass.
What was the kid's first symptom? You did the history of his 800 symptoms. Which one hit him first?
The cough.
Gout.
Are we talking about Brandon?
Gout? Uric acid crystals in the joints? His symptoms are pain, swelling, redness, stiffness, not one of which do I see on that board.
Because he doesn't have gout.
Maggie, I need a doctor in the waiting room.
Got it. Dr. Choi, we're up. LaShawn, hold on to this. Be quiet, please. Clear out, clear out. Here. Sir, take this chair and move it, please. Thank you.
She kept falling over onto the person next to her. I can't wake her up.
Ma'am, can you hear me? She's snoring, so she's protecting her airway, able to breathe. Good pulse.
Who is she? Patient here to be seen?
No idea. She never checked in with me.
Anyone know who she is?
Mags, see if there's an ID.
Yeah. I got it. Illinois driver's license. Her name is Rachel Wexler. 30 years old, lives in Evanston. That's not close.
No, don't know why she's here, but she's a patient now.
All right, get ready to clear out. Move, people. Move. Go. Doors, treatment floor.
What do we got? Fell asleep, now won't wake up. OD? That's my guess. A drop and dash or maybe a last fling before coming in to get treatment. Doris push 2 of Narcan?
Yep.
Mags, any more info from her purse?
Wallet, keys, makeup, gum, birth control pills, and cigarettes. Nothing helpful.
BP 104/68, heart rate 72, pulse ox 99%, EKG normal sinus rhythm.
Not exactly OD vitals, Dr. Choi.
No response to Narcan.
Told you.
Narcan only counter-reacts opiates. Must be a benzo. Push 0.4 flumazenil in order. CBC, CMP, ammonia levels, arterial blood gas, BAC, and blood and urine tox rings.
Maggie, she's wearing a wedding ring. Can you find a contact for her spouse?
What if I could, but no cell phone? But a charger. So I'm guessing she had one at some point. If she's stumbling in your high, who knows where she lost it?
Flumazenil's not working either.
Okay, OD's out. Doris, add an HCG as CT chest, spine, abdomen, and pelvis to the test.
Got it.
Dr. Stoll, you're thinking injury. All I'm seeing is a scar on the right cheek, but it's all clearly healed.
Just because there's no bruising doesn't mean there's no trauma. You should know that, Dr. Choi.
Miss Wexler, I'm Dr. Choi. I've been treating your wife.
What's wrong with her?
Well, we don't know yet. All her tests have been negative, including the tox screen. But given your wife's drug history,
You think she overdosed?
she might have taken something that's beating the test, possibly a synthetic.
Rachel was in a car accident a few years ago. Her back broke her jaw and a bone in her cheek. And the injury's healed, but the pain pills, after her last arrest, she promised that she'd stay clean. Here we go again.
Meds alone aren't taking enough pressure off of Dan's heart, so I'm going to put him on ECMO. Full support so that his heart doesn't have to shoulder any load.
When you first diagnosed the GCM, you said ECMO was the final option. I told myself to make a plan, to prepare for this moment, but I couldn't do it. I felt like giving up.
I promise you, that's not what's happening here. Okay?
How's your TBI patient? I saw pneumonia on his chart.
Pretty sure he got it from his trach tube. It was filthy. His mom's his caregiver. Looks like she hasn't been cleaning or suctioning it.
What, neglect?
No, I don't think so. All other areas, Sam is meticulously well cared for. His nails are trimmed, his teeth are brushed, skin is moisturized.
So mom's burnt out. First thing to slip was a tube?
Ever since Sam's injury, she has devoted her entire life to caring for him. I'm not sure how to tell her that she may no longer be up to the task.
You want some backup?
No, I don't want her to feel ganged up on. I'll figure it out.
Ah!
So the Zofran hasn't helped at all.
No, and the cramps are unbearable.
So is her gas.
Hey!
No fever, vitals are normal.
All right, let's hang another liter of normal saline and order a CBC, CMP, amylase, and lipase levels. Okay? This might be a stomach bug, possibly kidney stones, okay? I'm gonna press on your stomach.
Ah, wait! I need a bathroom.
Okay.
Oh, okay.
I need a bathroom right now.
Come on, honey.
Okay, hold on a second.
We'll get you there.
Ah!
Oh!
What?
Whoa. Sorry.
That's okay.
Honey, let's get you back into bed.
Oh my God, no! I still need to go.
Okay, I'm gonna have
really bad.
Wait, no. That's not urine.
Okay, let's get you right back into bed. Come on.
What's going on?
What's happening?
What's going on?
Ow! Shoot! Ah! What are you doing?
What's going on?
Yikes!
What is going
Really?
on?
Are you? Whoa!
Oh.
Okay, Miss Davis.
Yeah.
You're gonna want to push, but don't.
Oh, wait, no. This is not possible.
Oh, what is going on?
Your wife is pregnant
Oh.
and in labor.
No, that can't be true. I'm 55. I've been through menopause.
I know this might be a shock, but this is happening. I am positive. Page OB.
I'll be right back, okay?
Oh my God!
Oh, my.
What the hell, Connor?
Not here.
That motorcyclist is an HLA match to my patient, Peter. But suddenly, your GCM patient is above him on the transplant list? How did he come in this morning at status 2 and suddenly jump to the highest priority?
I had to put him on ECMO.
Before other meds. Milrinone, monoclonal antibody therapy.
They're just stopgaps.
That doesn't sound like someone about to OD.
All right, but if it's not drugs, what the hell knocked her out?
You missed something. Recheck every test result. Look for anything that might be mimicking something else.
Her MRI. These two spots of diffusion restriction. Radiology says they're from movement, the metal artifact, the plate intercheek. But what if that's wrong? This could be damage from a stroke. A clot that's knocked out the reticular activating system.
I don't...
Look, RAS controls wake and sleep patterns.
Easy, Quincy. That would take a huge clot. The damage would be far more extensive than this.
Normally, yes. Because most people have 2 vessels that provide blood flow to the area, but some only have 1.
The artery Percheron.
If Rachel has this variant, a small clot in just the right area would take out the RAS.
She's been out for about 4.5 hours. We missed the window to use TPA to bust the clot.
Still may be able to reverse the damage with local thrombolysis.
Okay, so get on it.
This is not a debate, Dr. Rhodes.
My patient's HLA is an ideal match to the donor.
But his antibody levels are not. They're too high and suggest he'll reject a heart. So it slides to the next person on the transplant list, Dr. Becker's patient, Peter. I'm sorry.
Without that heart, Dan doesn't stand a chance.
Neither does Peter.
No, actually, he does. Because the artificial heart that you put in can last months, possibly even years. Dan doesn't have that kind of time. Peter, he's had 2 hearts already, and with each transplant, his chances of survival decrease. It is not fair that he gets a 3rd heart before Dan even gets his 1st.
There's no limit to the number of organs a person can receive. And it's impossible to compare patients in need. That's why there's a list. To crunch numbers and break ties.
You're right. It's all about the numbers.
Okay. No, right. I understand. Okay, bye.
I canceled our trip. They asked if I wanted to rebook for a later date. I said, sure, in about 18 years.
What's that saying? When we plan, God laughs?
Speaking of planning, we need diapers and a crib and a car seat and bottles and onesies and did I say diapers?
You did.
I ate sushi. I had the occasional glass of wine.
I am happy to report that you have a completely healthy baby girl.
Really? Oh,
Amazing.
yes.
Hello.
Oh,
God. Oh, holy cow, you weren't kidding.
This is our son, Martin, and our daughter-in-law, Amy. And Haley, come here and meet your, aunt.
How about that, huh?
We'll give you all some time.
Thanks.
Very much.
Right this way, guys.
It's weird that Will was so adamant about calling the cops. What do you mean?
Well, last week's patient, Vic Thomas, he had advanced stage cancer and he was refusing treatment. Will sent me out of the room to get a cautery, and when I came back, Vic was dead. I can't be certain, but I think Will let him die.
What did you do? Oh my God. He's not hooked up. Need some help here. Ma'am, I need you to step out. Right now, ma'am.
I love you, Sam.
Ma'am, please. No pulse bag.
I need you to step back here, please. Step back, please.
Quick look.
Asystole.
Milligram of epi.
Still no pulse.
Another milligram of epi.
Please don't hurt him. Just let him go.
Time of death, 1860.
It did not have to get this messy.
I had no choice, Natalie. When someone commits a crime, you have to report it.
Except when it's you?
What are you talking about?
Vic Thomas. You let him die.
That's why you've been walking around like a ghost, right?
I don't know what April told you, but Vic Thomas explicitly and repeatedly expressed his wishes to me. And there is a monumental difference between allowing someone to die naturally and intentionally causing
Well,
their
if you
death.
did nothing wrong, then why keep it a secret?
No, don't you dare compare what I did to what happened here today. Natalie, they've murdered him.
You backed them into a corner when you called the police. You forced that family into a decision.
These are the results of Dan Kennett's latest panel reactive antibody test. His antibody levels were above 80, but now
They're within transplant criteria.
Antibody levels don't just go down on their own that quickly.
you can see for yourself. I had the lab run it twice.
I'm sorry, Dr. Becker. It's not my decision. Dan Kennett is at the top of the list. Assemble the transplant team and notify Mr. Kennett and his family.
Emergency plasmapheresis and IVIG. Didn't you? You made Dan look like a better candidate than he really is. As soon as he's off the plasmapheresis and IVIG, his antibody levels will shoot back up.
Maybe, but the immunosuppressants that he's going to be on post-transplant should ensure that his body doesn't reject the organ.
We got it all covered, huh?
Hey, look, I did what I had to for my
At the
patient.
expense of mine. So do me a favor, okay? And save your self-righteous hero speech for someone else.
Did she wake up?
I'm hopeful. Interventional radiology was able to locate the clot and clear it.
But she's so young. What caused the stroke?
A DVT, deep vein blood clot. Cigarettes and birth control pills were found in Rachel's purse. Smoking on the pill can sometimes cause one.
But how'd it get into her brain?
A PFO, a hole in the heart. They're not uncommon. Most people don't even know they have them.
Chica.
Oh, thank God, Rachel.
Where am I?
The hospital.
Rachel, I'm Dr. Choi. Do you know what day it is?
Tuesday.
What's the last thing you remember?
I sat down to wait for my cab. I had a job interview.
The nurse told me. That's where you've been going in the afternoons, isn't it? Looking for a job? Why didn't you tell me?
I messed up so many times before. It's a surprise you, show you that I really changed.
And there's a lack of neurological care. The area is rife with chronic illnesses that often expresses conditions like seizure and stroke. Provide neurological screening and rehabilitation there, and we reduce our hospital's census.
Killer idea, Cal, right next to my drop-in center, right? Plenty of room.
These are all wonderful, wonderful ideas. I have to say.
Dr. Fuentes.
But
you too. Totally controversial, but I think laser tag will go gangbusters there. That and Dr. Reynolds wanted me to suggest elective surgery center. In case you know, you go for the laser.
Guys, love all your ideas, really. I don't know when this became Land Grab Tuesday, but the decision for how this land will be used will be made the New Amsterdam way, meaning it won't come from us.
no, it'll come from the community. We'll reach out directly to the people and we'll find out what their greatest needs are.
That's what I was going to say. While this land may be our project, it is not our focus.
I'm hitting bone.
Crap.
Okay, Domino. Your foot is infected really bad.
You gotta fix it though, right?
I can't, my friend. Look, the surgeons are gonna come and they're gonna take you to the OR. Or most likely, they're gonna have to amputate your foot.
No,
I'm
what
so
are you
sorry,
talking
but
about?
you are in safe hands.
Hold on a
Okay, Domino.
second. Dr. Bloom, hold on a second. Dr. Bloom, please don't let them take my foot. Dr. Bloom, please. Please, Dr. Bloom. Dr. Bloom, Dr. Bloom. Please.
No, Kitch. Go back to where we picked up Domino and grab his bike. What do you want me to do with the bike? You pick it up and you put it in your ambulance. And you know what? It better be here by the time he wakes up. Go now! Thank you.
But you have such beautiful skin, Carrie. We've always told you
I'm
that.
still trying to wrap my head around why, kiddo.
You're being adopted means that we chose you for who you are. Remember?
Just Tell us where you got those pills.
Probably on the internet.
Mr. and Mrs. Logendorfer, I'm gonna need to run a few more tests on Carrie. May we have the room for a few minutes? Thanks.
Dr. Nielsen to neonatal. Dr. Nielsen to neonatal.
Are the tests going to hurt?
Just another blood draw. But you look like you could use a break.
Yeah, we're all kind of crazy. And this is...
That's a lot. You know, Carrie, based on how you're dealing with race, I'm still going to order a psych consult
I
for
know
you.
I'm mixed race, Dr. Reynolds. My bio mom's white and my bio dad's black. That's why I look the way I do.
And you're tired of the way your skin looks?
Only when it causes a problem. Like when people stare at my family. Or at the dance tournament.
Something happened there?
Why do you care?
Because you're my patient. And you don't know me, but sometimes it makes it easier to say stuff.
Nurse Phillips 3401. Nurse Phillips 3401.
We were changing, and I forgot my leggings in the van. Coach Jessa let me go get them, but when I tried to get back into the dressing room, this judge lady stopped me. I told her I was with the Dancing Dells, but she said that there was no way I could be with them. And she just wouldn't let me in. And like forever later, Coach Jessa came out and she was mad that I took so long.
Well, did you explain what happened?
Yeah, but she said that the lady had just made a mistake. No big deal.
But it felt like one.
I just want to be like everyone else in my family.
She shouldn't suffer any long-term effects based on our tests.
Oh, thank God.
Thank you.
Well, she's lucky. I mean, kids are resilient. Please. But I would be remiss if I didn't share my concerns about her identity struggles that caused this. I mean, she's gonna need help navigating through that, and that's the only biracial child in your family.
We're very aware that we're raising a biracial child, Dr. Reynolds.
And we don't treat her any differently than the rest of our children.
Yeah, but she is different. Very different than her whole family and the predominantly white community you're raising her in.
You make that sound like an indictment.
You might be feeling that, but I'm just stating a fact. I mean, do you know what happened at her tournament? A bigoted official didn't believe Carrie was with her team when she tried to rejoin them. And then her coach dismissed her experience of the encounter, called it all an honest mistake.
It sounds like Coach Jessa was clumsily trying to handle an awkward situation.
Right, but in the process, she racially gaslit your daughter.
She knows she can talk to us about anything. There's nothing we can't talk about.
Yeah, but you can't put this on Carrie, Mrs. Logendorfer. I mean, she's a child. It's your job to talk about race, right? I mean, how else is she going to get comfortable talking about it?
We just don't want to make a mistake. You say one wrong thing.
Everyone gets so angry.
No, but you got to be willing to make those mistakes. I mean, we've all lived long enough to know that there will be anger. But you need to get over your own discomfort. For the sake of your child.
Surgery went as well as we could have hoped. Just below the knee.
Don't worry, got your bike and all your merch down the ED.
Yo, one of my boys needs a new pair of earbuds, so...
Let's see if he needs a new bike, too.
Domino, look, I know this is shocking, but you could have died out there on the sidewalk. You're gonna recover, and we're gonna help you.
Seeds? What am I supposed to do with these?
Plant them. Your diabetes got out of control because medication alone can only do so much. You have to completely change the way you're eating to have a fighting chance. Leafy greens, legumes, lean proteins, healthy living.
What, I'm expected to be Farmer John now?
Oh, I'm sorry. I thought that I was talking to the guy who made $50 of us in 5 minutes flat. Bringing you an opportunity, but if that ain't you anymore.
All right, whoa. Take it easy. Ain't no reason to put that kind of energy out there.
Okay, now that land out in Desmond Park, they are gonna build something on it. But honestly, that's gonna take some time.
Yeah, with inspections, planning. Those permits gonna take longer than a G train on Sunday night.
In the meantime, who's to say what happens on that land?
Maybe somebody plants some vegetables, sells the rest for a very
Say no more. It makes dollars, it makes sense. Thank you.